Elfabrio 2 mg per milliliter intravenous solution is used to treat Fabry disease, an inherited disorder that causes a buildup of a certain fat substance in the body. If left untreated, this condition can lead to kidney disease, heart attack, or stroke. This medication works by replacing an enzyme that the body lacks, helping to break down the fat substance and lessen the buildup in the kidneys and blood. It is important to take this medication as prescribed by your doctor, usually once every 2 weeks. It is best to take it at the same time on the scheduled day to ensure optimal benefits. The medication Elfabrio 2 mg per milliliter intravenous solution is given through a slow injection into a vein every 2 weeks. A healthcare professional will administer the injection, and the dosage will be determined based on your medical condition, weight, and response to treatment. To prevent a reaction during the injection, your doctor may prescribe medications such as acetaminophen, antihistamine, or corticosteroids. It's important to follow your doctor's directions for using all medications and to report any symptoms such as chills, flushing, itching, nausea, or muscle pain. If you are using this medication at home, make sure to learn all the preparation and usage instructions. If anything is unclear, consult your doctor or pharmacist. Remember to remove the medication from the refrigerator and let it warm to room temperature before mixing. Do not shake the mixed drug as it can affect its effectiveness. It's important to use this medication regularly to get the most benefit from it. You may find it helpful to mark your calendar for each dose. Be sure to inform your doctor if your condition does not improve or worsens. When using Elfabrio 2 mg per milliliter intravenous solution for Fabry's disease, you may experience some injection reactions such as pain at the injection site, diarrhea, stomach pain, tiredness, back pain, nerve pain, or cold symptoms like runny or stuffy nose and cough. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. It's essential to remember that this medication has been prescribed because its benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. While a very serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. For medical advice about side effects, you can call your doctor or report them to the FDA in the US, or to Health Canada if you are in Canada. During and after your infusion of pegunigalsidase alpha, a healthcare professional will closely monitor you for any signs of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, shivering, headache, trouble breathing, or chest pain. If you experience any of these symptoms, seek medical help immediately. Your doctor may prescribe other medications to treat these side effects and may adjust the speed of your infusion based on your symptoms. Before starting pegunigalsidase alpha, it's important to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also crucial to discuss your medical history, particularly if you have had previous enzyme replacement therapy. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using. For pregnant women, it's important to discuss the use of this medication with your doctor. Additionally, it's uncertain whether this medication passes into breast milk, so consulting with your doctor before breastfeeding is recommended. As always, it's best to seek advice from a healthcare professional before using any new medication. When taking Elfabrio 2 mg per milliliter intravenous solution for Fabry's disease, it's important to be aware of potential drug interactions. Certain medications may affect how Elfabrio works or increase the risk of side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medications without consulting your doctor first. If someone has taken too much Elfabrio and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. During your treatment with Elfabrio, your doctor may perform lab or medical tests to monitor your condition. It's important to attend all scheduled appointments for these tests. Remember to take each dose of Elfabrio as prescribed by your doctor. Do not take an extra dose if you miss one. If you do miss a dose, be sure to consult with your doctor or pharmacist for a new dosing schedule. It's important to stay on track with your medication to effectively manage Fabry's disease. When storing Elfabrio 2 mg per milliliter intravenous solution, remember to keep it in the refrigerator, but do not freeze it. Once removed from the refrigerator, make sure to use the mixed drug within 8 hours. Any unused portion should be discarded. Keep all medications away from children and pets. It's important to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.